ID layer, these are the visceral pleura. Okay, parietal pleura and yeah, so the parietal pleura we can point out on the cadaver. So these are the visceral pleura. And then we say ID lobe, this is left upper lobe, left lower lobe, right upper lobe, right middle lobe, right lower lobe. With the horizontal fissure, the right oblique fissure, left oblique fissure. Diaphragm. Here's your hyoid bone. Thyroid cartilage. This ridge is the laryngeal prominence. Cricoid cartilage. Trachea with the tracheal cartilages. Cricothyroid ligament. Cricothyroid ligament. This is your thyroid or thyroid gland. Okay, so this region where all those structures, blood vessels, the main bronchus, nerves, lymphatics enter and exit out of the lung. That region is the lung hilum. So there is your thoracic aorta, continuing as abdominal aorta in the abdominal cavity. Left main bronchus, right main bronchus. Lobar or secondary bronchi. 2 on the left, 3 on the right. And then you also have your tertiary bronchi. Remember, these blue ones are the pulmonary arteries. The red ones are the pulmonary veins. With this model, so this is anterior view, thyroid cartilage. If we want you to say laryngeal prominence, we'll point to the ridge. But if we label on the side, that's thyroid cartilage. Cricoid cartilage. Cricoid cartilage, cricoid cartilage. Okay. Thyroid cartilage. Epiglottis. Vocal cords. Hyoid. Okay. If we say ID region or ID space or ID passage, that's your larynx. Down here, it will be trachea. But we say ID structure, those rings, those are tracheal cartilages. On the posterior aspect of your trachea, those are trachealis muscle. Something here, hyoid bone, thyroid cartilage, laryngeal prominence. Broken here, but this is epiglottis. Vocal cords. These are the arytenoid cartilages. Cricoid cartilage. Trachealis. Tracheal cartilages. I think I showed the thyroid gland. Forgot to mention the carina is this point of bifurcation where trachea becomes right and left main bronchi. This is carina. Okay, secondary bronchi or lobar bronchi. 1, 2, 3. Okay, and tertiary bronchi or segmental bronchi. Esophagus right here. Esophagus right there. And this model allows you to see going through those transverse foramina in red. That's your vertebral artery. going through the transverse foramina of your cervical vertebrae. Okay, so this is the nasal cavity. I think that's on the list, but nasopharynx, oropharynx, laryngopharynx. Esophagus is here. Thyroid cartilage, cricoid cartilage. This space, this region is, or the passage is the larynx with vocal cords. Epiglottis right here. Okay, again, that's nasopharynx, oropharynx, laryngopharynx. If we ask you ID space or region or passage, that's what we're referring to.